My name's Alan Cohen. I've been a GP for 25 years and I'm the primary care lead for this programme. There are about 270 million consultations with a GP each year, of which about a third have a significant psychological component. And the frustration for so long has been the inability to offer people what they want and what they need and evidence base for the effectiveness, which is an effective psychological therapy service. And that's why this program is so helpful. The sort of people that we see who have psychological problems when they come to see us are not just those with depression and anxiety, but often people with a variety of physical complaints and symptoms for which there's no obvious underlying medical cause. There may also be people with employment problems or accommodation problems, or people with continuing what's known as long-term conditions such as diabetes or respiratory conditions. And we know certainly for people with diabetes who also have depression that they have a poorer control of their diabetes, so that they're more likely to use medication, more likely to use more medication, and more likely to be admitted to hospital. So that managing the psychological consequences of long-term conditions will have a benefit both for the psychological part of their presentation, but also for the long-term condition. In the same way, respiratory conditions, people often have anxiety as well as the respiratory problem, and they're more likely to be admitted to hospital as well, and managing the anxiety will make it less likely for them to be admitted. There's a whole range of different problems for which a psychological aspect of it is significant. This programme offers for the first time in primary care a real opportunity to offer patients choice about the sort of intervention that will work best for them. We know that people, when they come to see us, often have a good idea of the sort of treatment that they would like. And certainly some people with depression and anxiety do want medication, and that's entirely appropriate for them. But for others who don't want medication, to have the opportunity to offer them an effective evidence-based psychological intervention is fantastic. One of the biggest frustrations I have as a GP is when I see a patient with depression or anxiety and I want to offer them a choice. The choice is unreasonable. The choice is you can have an antidepressant medication now, or you can wait 18 months for psychological therapy. That's no choice. And what this program offers is a choice that is meaningful, and that is fantastic. There's been a concern about how the service is going to be commissioned and whether it's only going to be commissioned by the Primary Care Trust. I think that practice-based commissioning of this service offers a fantastic opportunity. We know that primary care concentrates and specialises in providing generalist care, understanding the whole person effect of a particular problem. That we know that employment influences somebody's health. We know that poor accommodation influences somebody's health. And the opportunity to make the link between physical health care and employment at a local level through practice-based commissioning, so that primary care can ensure that the service that people need is delivered, is enormous. And I think that the practice-based commissioning of a psychological therapy service that fits the IAPT model, that complies with NICE guidance, is a tremendous opportunity that we haven't had before. And I think that I'd be very happy for those of you who are interested to know how to do this in a bit more detail to contact me at through the IAPT website to discuss this further.